In nursing, not everything is based on a job description. Going through the process with the patient during the most difficult time is what's most rewarding and most important to me.
Gene came to our unit when he was having a complication after his surgery.
And when he came in, he was sick, he had a fever, he was having trouble breathing.
It was scary because it was very serious. I remember the first night, two nurses in particular, Emily and Anna. They just were in total control. They knew what they were looking at. They knew how to address it.
So when we get them to the unit, like my first job is like, okay, you know, you go through everything, like look at the patients, see how they're actually doing, check their vitals, reassure them, and just get them settled.
You know, as a fireman, we appreciate nurses because they see and do a lot of what we do. And they just, it's like me going to a fire, you're on autopilot. These nurses were on autopilot. They knew exactly what they were doing. It was perfect care.
For patient care, it's really important to make sure that they know that you're there for them no matter what, and that you're there wholeheartedly.
All the nurses on the floor were fantastic. Especially my nurse practitioners, Gloria and Kristen. They were like the team leaders. If I went anywhere, when Gloria was working, she went with me. They made sure everything was done right to the way they wanted it. And Kristen is my laughing partner.
He was fun.
She always came in with a big smile. She was there at 6 o'clock in the morning with the doctors. The surgeons came in, they'd leave, and she'd come back in with a laugh. She goes, "Did you get any of that?" And she'd just sort it all out for me.
As a nurse practitioner on the team, I find one of my most important roles is making sure that the family and the patient know what's going on. And if the patient knows what's going on and what to expect and what might happen and what's likely to happen, and the family knows that, everyone's anxiety is brought down and everyone can focus on getting better.
Colette was the one I was always in contact with on the phone. Every little cramp I had, I was on an email and she was back to me immediately.
I know that when patients are calling, they have a concern, and I know that their anxiety could be elevated and they have a worry. If I wanted to call a doctor, I don't want them to call me back in a week. I want them to call me back hopefully by the end of the day.
You just can tell they love what they do. They really care, and you know it.
One of the things I think that sets Sloan Kettering apart from other hospitals is the quality of the nursing staff. We all work together very well. We're a team and people want to be here. People choose to work here and people are proud of what they do. So it makes a difference.